Hey guys, so this is my first time ever making a post in video format on my blog. And today I want to address a couple of questions that I get pretty frequently from followers. And those questions are things like, how do I go about scheduling a therapy appointment? What can I expect during my first appointment with a therapist? And what's therapy like overall? So today I'm going to try and answer those questions with my own personal experiences from being in therapy, as well as things that I've heard from other people who have been in therapy. So in terms of the first question, which is how can I go about scheduling a therapy appointment, oftentimes just give them a call. Generally, it's pretty much the same. You call, give them your name, some other personal information like your birth date, things like that. Sometimes there may not be appointments until later out, so it's up to you to kind of decide if you feel like you can wait that long, or if you feel the need to see somebody a little bit sooner. You can always express that over the phone and see if maybe they can try and get you in at an earlier time, or you might want to consider calling somewhere else and seeing if you can get an earlier appointment. The second question, what to expect at my first therapy appointment? So I have been to therapists that are both affiliated and unaffiliated with my university, and in both instances the first session kind of goes the same way. They'll just kind of sit you down, get to know you a little bit, kind of talk to you about the reasons that you are pursuing therapy. It sort of gives the therapist a chance to A, get to know you, and B, start to plan like a course of treatment for you, and think about what things might be good to do during future sessions. For you, it gives you a chance to get to know your therapist, to become acquainted with the therapy space, and to ask any questions that you have to clear up any sort of uncertainties or fears that you have about therapy. Before every initial consultation that I've ever had, the therapist will come out, shake your hand, introduce themselves, and then you have an opportunity to introduce yourself. My name is. Oftentimes they'll kind of make small talk as you walk back to their office, and they usually will start with something like, oh, what's bringing you in today? And that's kind of your cue to tell them whatever you feel like you need to tell them. Sometimes it's helpful if you think that you might forget something, or you're a little nervous about the first session, to bring a list of things along with you. You can just write it down or put it in your phone. I've never had a therapist tell me that I can't look at a list or read something off of my phone. Having that list with you can help you feel a little more at ease and help you make sure that you don't forget to mention anything that might be important. I think it's also good to emphasize that you don't need to tell your therapist everything during your first session. If you come in with something that you don't feel comfortable talking about, you don't have to mention it to your therapist on that first day. You can even simply say, I have a lot going on, I'm feeling however you're feeling, but I'm having a lot of trouble expressing why I'm feeling this way, or there are events that happened in my past that I don't really feel comfortable talking about, but I'm hoping that this can be a safe environment for me to talk about those things. And the therapist is not going to push you to share things that you don't quite feel comfortable sharing yet, but it's always helpful for them to have that information and to know that maybe there's more under the surface than initially meets the eye. So in terms of what therapy is like in general, after that first appointment, you'll schedule more regular appointments. When I first started going to therapy back in high school, I went every 2 weeks. And then when I started in college, I actually started going every week. So it's just kind of what feels best to you and what the therapist thinks is a good idea for you as well. Sessions in general last about 50 minutes each, and that's been standard both at Miami and with the therapists that I've seen outside of Miami. Oftentimes you can come in and just tell your therapist exactly where you want to start. So if there's a pressing issue that you've been dealing with all week, and you feel like you want to talk about that, you can talk about that. If you feel like you want to talk about something that's been more ongoing, that's always an option as well. I've never had a therapist stop and say like, oh, let's not talk about that today. And it's okay to spend an entire session talking about one thing. It's okay to talk about 5, different things during a session. I've never had a therapist say, no, we can only talk about this one thing. It's your therapy session. You are just as much a part of it as your therapist is, and you are very much in control of what you talk about. Again, I think bringing lists or reminders in can be helpful. Sometimes I come in and just know in my head what I want to say, but other times I've jotted down things throughout the week or the night before. If you do forget what you wanted to talk about, your therapist can work with you to kind of jog your memory a little bit. If you're feeling nervous during a session or uncomfortable, let the therapist know that. I was so nervous when I first started therapy. And in high school, I never told my therapist that I was nervous. I think that they knew, but I was always afraid to verbally express that. When I got to college, I started just straight up telling my therapist how I felt. Like, I'm feeling a little uncomfortable, or I can't quite say what I'm hoping to say or things like that. And again, they will be super patient and they will work with you through that. If you have a therapist who is not patient or who is you feel is forcing to make you talk about things that you don't want to talk about, or seems to be pushing you too hard, or doing anything that makes you feel uncomfortable and awful and you're consistently leaving feeling terrible, you should look for another therapist. There's nothing wrong with ending a therapy relationship and looking for a new one if somebody doesn't work out for you. It's just like any other relationship, like a friendship, where you need to find a person who's compatible for you. And the truth is, not all therapists out there are compatible for everyone. Everyone's different, and therapists are people too. So they have different personalities, and their approaches to things can differ greatly from one therapist to the next. So it's really important to remember that if you're having an awful experience with your current therapist, it's so worth trying to find a new one. And also, if you've had a crappy experience in the past, it does not mean that all therapists are going to be bad. I was definitely under that impression because the first couple of the people that I saw in high school were really, really terrible. But once I got to college and started seeing the therapists here, I realized that not all of them were bad people. And it actually took me 3 tries to find a good fit for me here at Miami. So I've seen a total of 5 therapists over the past 4 years. There is somebody out there who can help you, so don't let one bad apple spoil a whole bunch. So that is all for today. If you guys have any questions, comments, feedback, I appreciate it. I'm considering doing other videos in the future, so let me know if this is good, bad, ugly, or if you have any suggestions for things that you would like me to touch on, either through future videos or blog posts. Let me know. All comments, questions will remain anonymous. And that's all.